Welcome to the Inside Connection podcast, powered by MediConnect. I am Sean Horn, joined by my good friend Lance O'Brien, two of the longest standing members of MediConnect
Yeah,
of the group, right?
still standing, long standing.
Somehow, some way, right? And a few episodes into this now, we kind of gave a little bit of an overview as to who MediConnect is in the first few shows. And last time out, we talked a little bit about Medicare Part A, the hospital end of your coverage, as you said, the inpatient element of how Medicare works. Today, we're going to spend some time talking about Medicare Part B. And what I find most fascinating, I think, about the way that Medicare A and B work, they are so different from one another. Medicare A is free. Most of the time, there's a cost involved with Medicare Part B. How they work when you start to utilize them are considerably different. So let's walk through first and foremost, Lance. What does Medicare Part B cover?
Yeah, so again, if Part A is your hospital inpatient services, right, which can extend to skilled nursing, your own home, hospice, then Part B, on the card, it's going to say medical. It's really best understood as outpatient services, right? So what that would mean is primary care physician, specialist, my doctor visits, right? It would mean the emergency room, an ambulance if I have to get to the emergency room because I'm outpatient in those scenarios. Many times we hear about same-day surgeries, right? Hernia surgery, cataract surgery. That's outpatient in nature, so that would be covered by Part B. Then you've got blood work, physical therapy, advanced imaging. You've got Part B drugs, which we'll get into in a little bit more. But again, easiest way to differentiate, at least from a service standpoint, the difference between Part A and B is A is inpatient, B is outpatient.
So that definitely helps make it a lot simpler. And I think that we would be remiss if we didn't mention the fact that in order to have any kind of Medicare plan whatsoever, you need to have both.
That's correct. You can't get private insurance, whether it's a Medigap or a Medicare Advantage plan, without having both A and B. Now, you can get a standalone prescription drug plan if you have A and or B, right? I know I'm trying to make Medicare simple here, but to get private insurance, you do have to have both A and B.
So then what we could really, start to wrap our minds around is the fact that when you start to shop the type of Medicare plan that you want as you head towards retirement or, towards that type of healthcare, you have to have both in effect. And usually there's an initial enrollment period, which we'll spend a little bit of time talking about today. The initial enrollment period opens up around your Part B date.
Yeah, and I like to explain it this way. Your initial enrollment period begins, it's a 7-month period of time, 3 months before, the month of, and 3 months after you first get your Part B.
Which could be
when you first turn 65 because you retire or nobody that is in your household that you could get benefits from is actively working, right? Or you work past the age of 65, stay on your group coverage because it is better for you at that time, which you should always review that, right? But so whenever your Part B starts, that's when your initial enrollment period starts.
It can also start for you if you're declared disabled and collecting payments for 24 months as well. So if you're under the age of 65, you can also get Medicare. Again, trying to make this all simple. Oh boy, I mean, it's maddening to try to whittle this all down.
But a lot of rules,
a lot of regulations, a lot of oversight, and let's go into the the initial enrollment part of it a little bit more. So there's underwriting consequences as well that we've got to take into consideration for certain plan types as well. So if you're somebody who's getting onto Medicare for the first time and there's some health issues that are kind of popping up right now or in the short term that you really want to make sure you can get whatever coverage you want, we really have to pay attention around that Part B date.
Yeah, so I mean, when they brought out the Affordable Care Act, one of the big things around that was, excluding pre-existing conditions, right?
Sure.
And for the most part, that applies to Medicare, right? When you first start your Medicare, right? Medicare supplement, you have an initial enrollment period where you can get the coverage with no medical underwriting. If you don't get it in that time frame, then you're going to have to go through underwriting later. For the Medicare Advantage plans, there actually is no pre-existing conditions tied to it, right? I want to kind of circle back a little bit on cost, right?
Sure,
Because we
sure.
talked a little bit about how Part A is free, but Part B is not. But what about the advertisements on TV, get money back into your thing? What does Part B cost for people in general, Sean?
So most people for 2023, most people will pay a monthly premium of around $165. It's
Okay.
actually 164.90.
And how do they pay for that?
So that's a great question. It's something we get asked all the time in our seminars, especially if you're somebody who's not yet on Social Security. So let's talk about those who are on Social Security. That will be directly withdrawn from their Social Security check before it even hits their bank account.
Government likes to make it easy, don't they?
They sure do. It's funny how they claim
It's
that
the only
really quick.
easy part, getting your money.
They're good at it.
Yes.
Long standing tradition there. But if you're somebody who's not yet on Social Security, you will have to directly pay. They will send you a bill, much like your cable bill or anything else that you're paying right now. They'll send you a paper statement that you have to send a check in on. And let me tell you, Lance, I've actually experienced this a few times in my life where I had people who unfortunately missed their payment. And my goodness, what a mess it is to get Medicare Part B enacted as a result of missing that payment. So it's something you definitely don't want to do, is be lax on that. But so we're looking at that first and foremost. There are people out there, however, that will pay more for Medicare Part B.
Yeah. So if somebody has an elevated income, right, more than what Medicare feels they should make, they're going to pay an IRMA. What is that, Sean?
The IRMA is the income-related monthly adjusted amount. So basically what they do is they take a look-back period of 2 years. So again, here we are in 2023. They're going to look back at your financial statements from 2 years ago, so 2021, and whatever you claimed on your taxes is what they're going to determine what your wages were to figure out if you're underneath the IRMA levels or if you do have to pay one of these elevated amounts. And it is worth noting, especially here in this segment, that yes, that will impact Part B for medical, but it also can and will impact Part D for prescriptions as well.
Yeah, so I'll have to pay a surcharge, if you will, if I fall into those IRMA brackets. There's 5 of them. And I think that's where most people get tripped up is they're like, well, I'm going to be retiring, not making as much money as I normally make. And they don't realize that that two-year look back is a part of that equation. So very important. Again, we help people walk through that, really understand how that works for them. So standard premium, right around $165 for this calendar year. You can pay more, but some people don't pay a premium at all.
That is correct, and that's where the commercials that we're usually battling come into play. With Joe Namath and all these other athletes and celebrities from yesteryear, where if you're underneath a certain income level, and considered generally speaking, in the a little bit more desolate range, you're likely to not have to pay any Medicare Part B premium at all.
Wow. Okay. So it is possible to have no monthly premium, but it's not common, is it?
It is not that common at all. And I actually, quick little story about the IRMA situation. We were just talking about the elevated income. A few years back, I had a client who was considering getting on a Medicare for the first time, but 2 years prior, she actually won a considerable amount of money from the lottery.
Wow. Well, good for her.
Good
right?
for her. But it did make her delay starting her Medicare coverage, which I absolutely advocate for, to make sure that we can reduce that if at all possible. So she waited until those lottery winnings fell off of her income. So about a year later, everything was all set and good to go, and she's thriving with her Medicare now. So
yeah, and the good thing is that's kind of an exception to the rule, but important to know. But you can appeal IRMA too, right? There are certain allowances that they make, lower income because of work, right? Other certain types of thing where you can file an appeal on that IRMA and you could be potentially approved and you would pay the standard premium at that point in time.
I always say that it's almost like these agencies, whether it be Medicare, the state agencies related to financial help, even sometimes with these insurance carriers that, they try to catch you slipping a little bit. They hope that they send these items out to you, the mail, you ignore them, you just throw them away like some people may. And hey, we gave them an opportunity to respond. They didn't. Here's their situation now. So, there are times certainly where we've come across as well that we've been able to help people around that situation where the appeal did go through. We were able to bring things down. And, it always feels good when that happens because our goal throughout this whole process is to make sure that the people we're helping are paying as little as possible for anything healthcare related, whether it be from the government, from the insurance companies, the prescription coverage. We want you to get all the coverage you're due without cutting any corners, but we want you to pay as little as possible.
Absolutely. So again, we've got Medicare Part B. On your card, it says medical. It's your outpatient services. It's not generally free. Usually you pay a monthly premium that will come right out of your Social Security if you're taking Social Security. If not, you'll be billed quarterly. You can pay more for your Part B depending on your income on that 2-year look back as it relates to IRMA. So big question. I know we're coming to the end of this first part of the podcast today. We'll pick this up a little bit more in the second segment, but I pay my monthly premium. Does that mean I now have no more cost share, or are there costs associated with Part B?
There's almost always going to be more costs involved. That's to basically hold your red, white, and blue Medicare card is what you're going to have to pay. And then after the break, we're going to talk about when you go to use your Part B, what you're in store for as well when it comes to what percentages you're going to be looking at.
Deductible.
Exactly. Is there an out-of-pocket limit? We're going to talk about that as though you only have Medicare A and B and no private insurance. But it's the usage of Medicare Part B in totality. When you figure you're paying $164.90 for 2023, it's actually from the government. It's not that bad of coverage. It's really not.
Right.
What you do have to take into consideration, however, is you have to be mindful of filling in those gaps that the government does not pay for. That can be retirement altering from a financial standpoint if you don't adequately prepare.
Right. So come back from the break. We're going to dive in a little bit more to the cost share. We're going to talk about the big word penalty, because generally penalties as it relates to Medicare revolve around this Part B. We're going to talk about what they are, how to avoid them, all of those things. This is the Inside Connection podcast sponsored by MediConnect. We'll be back in just a couple moments.
Medicare is confusing and a little scary.
Plan B, Part B,
HMO, PPO. I feel lost.
Whether you're just starting Medicare or currently on Medicare, you're faced with critical decisions each year. Questions like, do I need a Medicare plan? Is my current coverage still my best option? Will I still be able to see my doctors? I'm Brian Breisinger with MediConnect, the area's premier independent healthcare advisory firm. We can help avoid costly pitfalls today and in the future. We can meet with you in person or over the phone. Choose an expert in your community.
MediConnect walked us through everything.
Best of all, it didn't cost us anything.
That's right. Our licensed experts can offer unbiased advice on all of your healthcare options at no cost to you.
MediConnect is a great organization.
MediConnect, bridging the healthcare gap. For no-cost advice, call 888-818-MEDI or go to MediConnectinsurance.com.
Welcome back to the Inside Connection podcast powered by MediConnect. Once again, I am Sean Horn. He is Lance O'Brien. And, we've decided to take a few moments and dedicate this show to Medicare Part B because it is a pretty tricky aspect of coverage that you do get from the government. So we've talked a lot about, the initial premium that you have to pay, generally speaking, what comes out of Social Security or what you have to, physically pay with the check. But we didn't talk enough, I don't believe, about when you actually go to use the coverage. So let's spend some time talking about that. Is that okay?
Yes, sure. So you've got your monthly premium, right? Paid out of your Social Security, generally for most people. And then once you go to use it, if all you have is A and B, right, you go and you see a doctor per se, you're going to have a deductible, right?
Okay.
Which most people are familiar with deductibles, although they get a little bit confused between deductible and max out of pocket. Deductible is what you have to pay before the plan pays anything, right?
Correct.
So they go to the doctor, they go to use any outpatient Part B service, they're going to have to pay the first $226. That's the deductible for the current calendar year. Once that deductible is satisfied, which it might take more than one visit, or it just depends on what the service is, right? If it's a advanced imaging, MRI, CAT scan, they might blow through the deductible in that one procedure. But once that deductible is satisfied, then they have their co-insurance. And whenever you hear co-insurance with insurance, it always means percentage.
Correct.
After that deductible, they're responsible for 20% of the additional Part B charges, right? So there's can be some costs, because whenever I hear percentage, 20% of what? That's the question I want to know.
Whatever the bill is, really.
That's it.
But again, let's circle back, because as we were exiting the last segment, for the dollar of $164.90 for 2023, it's not bad to get 80/20, because a lot of employees are paying something similar, and usually, from a co-insurance perspective, but they have to meet a deductible first. Deductible usually can be a lot bigger than that number
Right.
of 226, and they're also usually paying more in monthly premium for their coverage as well.
Correct.
So Medicare is, for a lot of people, bringing costs down. But as you just alluded to, that 20% can be very painful. And the reason why it is most painful is the fact that there is no max out of pocket with that 20%. There's
Right.
no financial shutoff switch.
Right.
It's a big deal. And I can, illustrate that further with, about 4 years ago, a client came in that I helped, referred over to me from the hospital system that we have a partnership with. And gentleman was getting ready to have a heart transplant and getting on a Medicare for the first time as a result. So we take care of all of his needs, get his insurance all set up, and 2 weeks later, his heart comes in. And the most mind-blowing part of this all is the fact that he spent only 5 days in the hospital. Okay? Now, from the medical perspective, the total billable amount of that procedure and the hospital stay was about $2 million.
Yikes.
So if he didn't have coverage to go along with Medicare Part B, he would have been responsible out of pocket $400,000.
Wow.
Because again, no shutoff switch.
Right.
That's an enormous part of the equation that people really got to, that's why you have to take this so seriously, especially when you're getting on a Medicare for the first time. And then year after, at the end of every year from that point forward. So
yeah, I think one of the things that we really talk to people about is if you're pretty healthy and all you have is A and B, for Part B, you go to the doctor, it's not going to be that expensive, if you will. But the problem is that if you have any kind of a major medical issue where you need to really have advanced services, that's when you could actually just have monumental bills as a part of it, and that no maximum out of pocket. Again, going back to group insurance, generally there's a threshold of
Right.
how much you can pay in a calendar year. Once you reach that number, the company pays everything else for the rest of the year. What we're saying is original Medicare Part A and B, they do not have a max out of pocket. So you could really end up spending a lot if you don't have private insurance to help you out.
yeah, and I mean, that's just a great breakdown of, and another reason why, there's unfortunately, it's being talked about a lot now, where there's a date in mind where Medicare is no longer financially solvent. And this is a big part of it, is because when you're responsible for 80% of the benefits of so many people that are out there, that's an enormous number, which is why it's the second biggest spend behind defense in our budget. So, I also wanted to talk a little bit about penalties.
Yes.
Something we get asked a lot in all of our seminars, when we have our radio show. I mean, it pops up all the time. So let's make it simple for folks. How can we avoid a penalty?
Yeah, so the big thing is once you're Medicare eligible, right, which for most people is at age 65, the question we get is, I heard I have to sign up at 65 or I'm going to get a penalty. That is not necessarily true. If the person providing the benefits is actively working, then you don't need to sign up for Part B.
That's a big thing we got to really highlight there. Actively working.
Yes. So say I'm the person that's turning 65, I'm employed, I have benefits through my employer. They're good benefits. I've done my due diligence. I've reached out to MediConnect, 888-818-6334, right? I've had them do the comparison for me, and it's determined that it's actually better for me to stay on my group coverage. Because I'm actively working and I have coverage, I can defer my Part B without any fear of that 10% penalty that comes with missing your enrollment.
So, okay, actively employed being such a big deal here. So, is Cobra creditable?
Cobra is not considered creditable coverage when it comes to Medicare. So once I go, if I'm past the age of 65, and if I go onto a Cobra plan, I at that point in time would need my Part B because Medicare does not recognize that as good as. That's what we mean when we say the word creditable. It's not as good as what Medicare provides.
Which is why we advocate for if Cobra is an option and yet Medicare is an option, we certainly have to get together with you because even getting on a Cobra is probably going to enhance your chances of a penalty, unfortunately.
Yeah, I mean, it's full price plus 2% for Cobra, right? So you're probably talking at a large premium there, where then at that point in time, getting onto Medicare would be more cost effective. But I think what's really important with this, Sean, is we run into people all the time who they hear someone say, you have to get it at 65. They sign up, they keep working. Now they're paying for their work coverage and they're paying for Medicare Part B at the same time, and they don't really have to be. So that's why it's really important. Plus, there's other little nuance rules of the amount of employees that are in your company. If you have less than 20 employees, even if you're actively working, you still need to get Part B at that point in time. If you don't, you could be subject to the penalty.
Or if you work for the post office, you
Yeah.
have to get Part B when you become eligible. So, I mean, and that's something another great question we are asked routinely whenever we hold our neighborhood events where we're providing education is, so do I need Medicare? And I think that we, talk about this ad nauseum, but it's worth bringing up again. There's no standard answer.
Right.
It's almost by circumstance and situation. And, you know, if you're on a retiree plan, do I need Medicare?
Yeah.
That's one that's about as tricky as it all gets,
Yeah.
right?
Yep.
If you're the retiree, you're probably okay.
Yeah.
If you're the spouse of the retiree, let the retiree better live a little bit longer, or else when you go to get on a Medicare later, there's going to be a massive penalty involved. And we've seen that actually in our own office.
Yeah, so there's a lot of challenges around that. And frankly, we don't see a lot of times people that were born in the same year married, right? My wife and I are 4 months apart. We were both born in 71, right? So
Okay.
it kind of simplifies when we're going to turn 65. But we find people who are 2, 3, 4, 5, whatever years apart, and that does impact what they're going to do, right? So walking through that individual situation, because we'll have a spouse that's turning 65, one that's 62, and they're like, well, I want to retire. How does that affect their insurance? So walking them through that. But you definitely want to avoid the penalty because, Sean, we kind of threw out a percentage, right? 10%. 10% of what and how long does it last?
So the 10% is of the Part B premium that year. So for this year, it'd be about $16, right?
Right.
But it compounds. Unfortunately, that's the big deal there. So for every year you go without, it's another 10% that will uptick on you. So we've seen situations, unfortunately, where, again, talking about that retiree, we had a lady come into our office a few years back where her husband was on the Mills plan, was happy as all get out. Unfortunately, he passed away. Time for Medicare for the wife now. We think everything is all good to go. We call up Medicare and find out because she was 84 at the time, she was going to be assessed a 20-year penalty because she got bad advice 20 years ago on what to do there.
Hundreds of dollars per month in penalty. And the penalty goes away
When they do.
when you do, right?
Yeah, when you pass away, it stays with you for the duration of your life. So that's really why you have to focus in and make sure the circumstances you're in, do I need it or not? That's why we have these events. That's why we're putting all of this material out there to make sure that you have the best information to make a decision for yourself. And another circumstance I believe that we should spend a little bit of time on is the fact that whenever the spouse is eligible for Medicare and the employee is still working, we're seeing it more and more where the spouse is actually getting kicked off of the group coverage because Medicare's there to catch them.
Yeah, I mean, if they're not getting kicked off once they actually do their due diligence, which again, we help with, right, of comparing premium, deductibles, max out of pocket, all of that stuff, what they're finding is that spouse who's the non-working individual, they're 75% of the monthly premium. Right. So a large part of it, and think of it from the company standpoint, they're providing it for the person that's working, not necessarily for the one who's not. Right. So
Fair.
in that scenario, we're seeing people who are like, the spouse leaves the group coverage, even though the husband or the wife is still working, because Medicare is more affordable at that point in time. So again, there's a lot of scenarios around, should I get Part B? When should I get it? Am I actively working? How many employees are in my company? Right. And I think, Sean, we help over 4,000 people a year get onto Medicare for the first time. Right. It's a large number of people. Right. So we've seen just about every scenario. So when we sit down with someone, we start with asking them questions. We want to understand their situation so we can give them the correct insight on what they should expect.
I think the president of our company says it best. So I'm going to use his words now, which is, let's get together and figure out if we can help you. From that point forward, it's up to you to determine, do you want our help?
Yes.
And that's a beautiful beautiful wording to live on when it comes to how our company operates, because there will be people out there where Medicare is not in your best interest yet. And when that does come up, we will tell you, you need to stay where you're at. Don't pay for Part B yet. Don't get on the drug coverage yet. But if I may, I will say that there's been recent reports that when it comes to cost of prescriptions, Medicare costs are actually doing much more to help when it comes to lower these costs than group plans are. So if you're somebody who's on a lengthy prescription list even, and again, Medicare's available, you have these group benefits available, it's worth, just making a quick little judgment there on, do I need this or not?
Right. No, for sure. And I think the last thing, as our time's about run out here today, goes quick, right, that we do need to mention is, if you miss your sign up time when you should get onto Part B, you can't just go and necessarily sign up the next month. There's a time frame that you have to wait in order to sign up to get your coverage. So we always want to make sure an individual is rock solid in their time frame of when they should sign up or if they need to.
Any Medicare questions you may have, that's why we're here. 888-818-6334, MediConnectInsurance.com, or you can find us on Facebook at MediConnect PGH.